Well, Jamie Jenkins is an independent statistician and joins us now. Thank you very much for speaking to us. Now, the problem is trying to work out how far this variant has spread is pretty difficult to do.
No, indeed. And I think the government have been criticised in the past. If you remember the first wave where we didn't lock down our borders, and then you had the Indian variant, which got renamed into the Delta variant. So I think they've moved fast, but I suppose they're damned if they do and damned if they don't, because some of the kind of health officials in South Africa are saying this is a massive overreaction. But it's still early days with regards to kind of the Omni variant. So I think that they've obviously acted to try and kind of tighten up the borders. But as you can see, the cases are already in the country. I think the important thing, I think you're just saying that they're saying to the public not to panic. But I think the way some of the reporting of this variant being potentially one of the most deadliest we've ever seen, I think only time will tell with that. But I think next few weeks will be important. So I think the government have acted, try and close the borders, but I think we've got to be careful not to overreact.
Yeah, and we've got to look at the statistics on the different factors. It's all very well saying it's much more infectious, more transmissible than the others, but if in that act you're not as ill as you are with others, that's a positive thing, and if it doesn't kill you, also that's a positive thing, clearly.
Yeah, indeed, Simon. And if you've track pandemics over the centuries, that tends to be what happens, is that because the virus needs to survive itself. So obviously there's no benefit to the virus by killing everybody. So they tend to become more transmissible and less deadly, which obviously would be a good thing if that's the case with this new variant. They're obviously talking about rolling out the booster vaccines to everybody. But I suppose some of the kind of messaging from the government has been that they're not sure if they keep saying that they're not sure if the vaccine would work with this variant. So kind of rolling out boosters for all does seem to be a bit of a strange policy to tackle that one. They would argue, obviously, that it's to kind of reduce the current variant that's going on. But I think the more important statistics at the moment, whilst the headlines are all about this new variant, is we are continuing to see patients in hospital falling across the country, and they're 56% lower than this time last year, and patients in critical care coming down as well. So all the signs and the stats are pretty positive.
We're so overwhelmed with data in terms of trying to track this pandemic and where the cases are, hospitalisations, deaths. For you, which do you think are the most important pieces of information?
Yeah, I think it's going to be the hospitalisations. But the problem you're going to get is that if you go before the pandemic, you'd always see headlines of the NHS being overrun and ambulances stuck outside. So with a pandemic on top, and remember, this is significantly lower than this time last year. That in part is because of the vaccine rollout. The boosters now, if we just talk slightly about those, they are seeing cases come down in older people with the booster rollout. And that's a positive thing, because it tends to be the older people who would end up in hospital and sadly dying, because we still know that this is a virus that 90% of all the deaths, even now, are still in people aged over 60. So the booster rollout's helping there. My concern, I think, with the booster rollout is I've just recently had COVID myself. I've had 2 jabs. Do I need a booster? Only 2 weeks ago, recovered. Very mild illness for me. And there's 29 million people in the country now who potentially might become unvaccinated by the government's definition. And we do have these vaccine passes in some parts of the UK. Will it affect them if they don't want to have the booster? And we do know, as we go through this pandemic, it tends to be people who are more vulnerable and elderly who are the most at risk to going into hospital. So rolling out of vaccines to everybody, it's not what we've done for the flu in the past. Is it a disproportionate response? Is my kind of point on that.
Yeah, and the frustration about where we are is we just got to the point where those that had all 3 jabs, they've done everything asked of them and are thinking, I'm going to take the risks now as they come. We've just got to live with this disease. What has happened in the last 72 hours is we're being taken into another level. And frankly, a lot of people are not prepared to go that extra mile.
No, Simon, and you've seen yesterday the First Ministers in Scotland and Wales have written to the Prime Minister asking for potential financial support if they need to go beyond kind of the current restrictions that are in place, i.e. closing businesses and potentially going into another national lockdown. Now, I think everybody was promised that the vaccine rollout would mean kind of the end to those dark days of going into these lockdowns. And they've brought masks back in England at the moment. They've been in force in Scotland and Wales, and the rates haven't been much different between the 3 countries when you look at it over the last few months since July when the kind of the policies changed. So I think people are getting frustrated because they were told the vaccine rollout would be kind of the end of this. It's a pandemic. We're not quite sure what's around the corner, but I think this new variant, there's a lot of panic about it, but I would treat kind of some of that panic with a bit of caution. People out of South Africa are saying at the moment it's looking like a mild illness. And these vaccine passports themselves, they've found the new variant in Botswana in people who are vaccinated. So even having a vaccine isn't bomb-proof in terms of stopping you catching these things.
Well, it's really good to talk to you, Jamie. Thank you very much for your time this morning. That's Jamie Jenkins.